Okay, so we're getting questions on selenium suddenly over the recent weeks and I don't know, a month or two. And I have been seeing selenium show up more and more and more in the vitamin lists of the patients who come in to my office. And so the question is should I be taking selenium for Hashimoto's? And the answer is, again, yes and no. I say again because I say that a lot. The answer is, again, yes and no. Selenium has been shown to, it can be pretty interesting. It can be pretty helpful in certain cases. Now, you have to understand, if I get 100 people to come in here with Hashimoto's, they're all slightly different. They all have slightly different triggers. They also are at different stages of disease, where some of them may have hardly any damage to their thyroid. Others are like a 10. Like, you can't touch your thyroid, it swells, it goes down, and everything in between. So that has, and then there are 39 different triggers for Hashimoto's. If you wonder why you're having a hard time figuring things out, these are many of the reasons, okay? And so different parts of their system are being affected. Whose pancreas is being affected, who's not, who's got oral tolerance problems, who doesn't, that type of stuff. So you have to have like an organized way of going about it, because you have all that going on. Enter selenium, okay, into that whole mishmash. And under, I would say, mild to moderate symptoms, I think selenium in and of itself probably gives you some advantage. And what it's been shown to dampen immune inflammation to the thyroid, and it's been shown to be able to correct thyroid stimulating hormone numbers. And that's what's interesting about it, is it's shown to get high numbers down and low numbers up. So that's pretty wild, and it's pretty cool. But depending on you, depending on how many triggers you have going, depending on how much inflammation you have, and if you get a lot of inflammation, it's going to take a little bit more than the daily dose of selenium that's on the bottle. And by the way, they put the doses that they put on those bottles are low. You know, usually, well, maybe I shouldn't say this, but usually the dosing needed for that particular person who has Hashimoto's is higher than what they put on the bottles. However, I don't know what yours would be. Okay, so don't go dosing up because I said that, and because I don't know where you would stop based on, I don't have all this information in front of me. So again, the answer is yes and no. It's not going to hurt. Here's what when I have people come in and they're taking selenium, I ask them. I say, how's that done? And if they say, I don't see any difference, then I just have them not take it, because what we're going to do is going to probably get the inflammation down better, and then at the end, if their TSH is high or low, and their doctors won't work with us to to adjust their hormone replacement therapy properly, then maybe I'll use selenium and I'll throw another one in there on you, or myo-inositol. Those two kind of work good together under the circumstances of that person is the appropriate candidate for them to work together. If the patient says, yes, I think it's really helped me, I just have them stay on it. Why wouldn't I? I just have them stay on it, and then I work with all the other things that are going on, but that's dampening inflammation in their system apparently, and it's doing what it does to alter their TSH in that particular person. And so, and I don't really have a percentage of like 50-50 or something like that. I mean, the best, because I kind of look at each case individually, and I've really only been seeing the selenium thing, even though I've been aware of it probably since 2008 that I've been aware of it. I'm sure it's been around even longer than that. And so I don't know what's going on. Is actually why I'm seeing so much of it on people's vitamin lists, and now we're seeing a lot of questions on it. But it's legitimate. It's something to try. You don't know what the dosage is going to be. You don't know where you are relative to damage and so on and so forth. So I can't guide you on dosage, but if you try it, you feel better, I would keep taking it. If you try it, you don't feel better, then you're either going to have to find somebody who maybe can say, here's what the dosage is. And there's websites. There's websites that'll tell you what the dosages are. I'm not saying that they're totally 1,000% for sure, totally trustworthy, but they can give you an idea of maybe if you're taking like, and I'm not going to even go milligrams. If you're taking this many milligrams and they're saying you should be taking those many, I don't think it's a problem if you try that and see how it works. But so it's kind of nebulous. It depends on the patient. It depends on the stage of damage that they have in their thyroid. It depends on how many triggers they have. It depends on a lot of things. Trial and error, probably not going to hurt. If you take it and you feel better, it's probably not your imagination, and that's kind of the skinny on selenium. I mean, it's not a drug, so it's usually not going to hurt to play with a little bit and see if it's right for you.